All right, our next guest this morning, I think a guy that sometimes is controversial, but I think a lot of times misunderstood. We've got Dr. Jack Kevorkian on the show this morning. Good morning, Doctor.
Morning.
Good morning. Now, you have this new documentary coming out called Kevorkian. It's going to be on HBO. It's going to air tonight at 9 o'clock. Before we get to talking about that, though, I had a couple of questions for you. First of all, I think even now today, after everything that has happened in your career, I think a lot of people still maybe misunderstand some of your work. Would you agree with me on that?
Well, they're propagandized to
Sure.
misunderstand it.
Sure. Because as I went through, because I did a lot of research, I looked up some of the history of things, and it's like, it seems like people are just so upset with death, and people are just either afraid to talk about it or afraid to face certain realities at times.
Yes, true.
Because as I look at things, and I think everything in the early 90s, particularly when things kind of blew up, it seemed like it was controversial in the sense that people thought you were going around, with these assisted suicides of people that, may or may not have been healthy. But in fact is, these are people that are suffering, and you're providing a way for people to end the suffering, right?
They contact me, so they must be serious.
Yeah, I would imagine, right? Now, what are the criteria that you look for in somebody who contacts you? What were you looking for then? I mean, what kind of validated their points and their reasons for contacting you?
Well, it has to be an adult, so I guess wasn't it the age of 18?
Right, sure.
And then is the patient's wish, his request, valid?
Mm-hmm.
I got to check on that.
Sure.
So I asked him to get me all his doctor's records, copies of them,
Mm-hmm.
so I can see what the case is now. And then I go through the records and see that maybe he has a treatment that he missed, or his doctor didn't understand. So I just make sure that all bases are covered. If they're not, then I recommend he go and see these other doctors.
Sure.
Just like any medical service. That's what any doctor does.
Exactly. Now, why do you think everybody kind of looked at what you were doing and the services you were providing in such a controversial manner? Because personally, I have a tough time trying to find the controversy in it, because I've within my family and stuff, I've seen things happen, and I've seen people suffer to the point where they clearly are suffering, and there has to be a more a better way of dealing with that instead of the suffering and the agonizing that's going on.
Sure, you got the right attitude, the right mental mindset
Sure.
for this.
Sure.
Right? If these people who oppose it,
sure,
if they saw a little baby, maybe 1 year old,
mm-hmm.
1.5, with hydrocephalus, in which the head is bigger than the body.
Right.
The head is bigger around than the body is long. I mean, bigger in diameter. Then they'd see it.
Sure.
Then they'd say, oh, my goodness.
Right.
See? In fact, they would jump in and do it.
Now, would you say that you had any, we're talking during particularly the early 90s when you were in the news a lot for being controversial and because of your assistance, but I got to say, did you have supporters at the time, or are there still groups that actually will support everything that you're doing?
Sure. I had a lot of supporters. That's why they lost.
Sure.
That's why when I went to prison, I got out, and all this publicity now, and yet you don't hear anything from the church anymore.
Right.
You don't hear any opposition now.
Exactly.
Because they know they've lost.
Exactly.
I meet people on the street, in tears, they come and shake my hand. I mean, I knew I would win because I was on the people's side. Everybody's got this right, and everybody wants the right to use it.
Sure.
And that's what they all misunderstood. The church blocked them, and the church blocks it by dictating our laws.
And you look at
this abortion controversy. What's the church doing in that? That's a medical problem.
Sure, exactly. And that's the point, and that's why I asked the question, because, now even with abortion, it's still out there. There's the pro-lifers, there's the pro-choicers.
That's because we have Catholic doctors. They're
Right.
not real doctors, though, because they can't talk about abortion.
That's
If
right.
you can't talk about a medical service and you're a doctor, and you can't advise about it, then you're not in the right profession. You should be a priest.
Yeah, well, exactly, exactly. Well, that's why I asked the question, because I wanted to make sure that the pro-choicers were behind you, for your work, because, here they are preaching the choice. And isn't this the same thing? You just happen to be an adult making the choice as opposed to a kid that, or a baby or a fetus that didn't have the choice.
Exactly. Every doctor who works in a Catholic hospital either will not talk about abortion or is afraid to talk about it. Either way, he doesn't talk about it. Mm-hmm. When a patient asks a question, he's not a real doctor. He's in the wrong hospital.
That's true. When
he's unethical.
I totally see your point on that. I totally get it. I totally see your point on that. So with everything that you're doing, did you ever get upset at some of the media criteria and the media throwing labels on you, Dr. Death, Mr. Suicide, all that kind of stuff? Did that ever bother you, or did you have such a good moral balance and say, look, I'm doing the right thing here. I don't care what they're saying about me, because you're still known as Dr. Death, the whole macabre thing.
Occasionally it bothered me. Anybody would get bothered. Occasionally, depending on the magnitude of the insult.
Right.
But obviously, it didn't bother me enough to stop me.
Sure.
I kept going because I knew I was doing the right thing.
Sure. Makes some sense. I guess when we look at the documentary Kevorkian, which is going to come out tonight at 9:00, what are we going to see in that? What was the very first kind of patient, or do you remember the first patient where you decided that, what, I need to help this guy end the misery? Do you remember that well, and how did that come about?
First case with Alzheimer's disease.
Okay, yeah.
Everyone said, well, physically she was sound, she was playing tennis, and all that. But that's not the point. The patient was terrified because she knew she was losing her mind, and she wanted to end it before she became a vegetable.
Right.
That's torture.
Sure.
That's really more pain than physical pain. So I said, I've got to help this person. It's her choice. I checked with her psychiatrist. He verified the fact that, yes, she has that choice. Yes, she is mentally this and that. And he sort of agreed with it. Then, of course, in court, he lied. He said, no, he didn't.
So, here you are trying to do the work and that somebody wanted you to do, and no one, he wasn't backing you at the time. That must have really made you feel great in the courtroom. Oh,
I'm telling you, look at, this last scandal in Medicare, you heard about it in the news?
Yeah, well, which one?
the latest one, where they, in several cities, they raided and they got them all together.
Sure.
They hauled in a bunch of doctors and nurses with them.
Right.
There you are. All unethical, yet all honored, and looked up to as honest, upstanding people. They're crooks.
Yeah, I hear you on that one. Dr. Kevorkian, I know we're running out of time and they're going to cut us off pretty quick, but thanks for being on the show. Really appreciate it, and continue to do the work you're doing. Thank you very much.
You're welcome.
All right, bye.